All right, my name is Charles Cerney. I am a retired physician, practiced years of medicine, and the last 10 years of it pretty much devoted to diabetes. This is a lecture that I usually gave to my newly acquired diabetic patients before they learned anything about the disease or what we could do about it. Diabetes is a disease that you have. You can't do anything about it. You inherited it, and it's part of a disease process called the Metabolic Syndrome. A good share of at least Western civilization participate in this problem. And it's composed of a number of different problems. Number one is high blood pressure. All of them who have this disease can and do develop high blood pressure. Number two is the inability to properly metabolize lipids, the fats that we eat and the fats that we deposit in our body and use. These are poorly handled in the metabolic syndrome. The other is the carbohydrate. Insulin is a substance that utilizes the carbohydrates that we store and turns them into energy, and it's really the device that enables us, all animals, to run and utilize energy and renew their energy and remain alive. These then are the three main problems with the metabolic syndrome. Diabetes then occurs in someone with the metabolic syndrome. Not everybody that has the metabolic syndrome gets diabetes, and so that these are individually variable problems within the whole system. And the one that bothers and makes the diagnosis of diabetes is that which involves the insulin mechanism of utilization for the source of energy. Insulin is made by the Islets of Langerhans in the pancreas. I will have another area that we talk about later on, in which we go through the pancreas and it's all of its digestive and metabolic powers and importance. But for now, we will just talk about the Islets of Langerhans. It was noted years and years ago, when anatomical studies were first begun and the microscope was invented, that one could see the fine microscopic anatomical configurations of various organs. And as they looked at the pancreas, they found that while most of the pancreas was made of little glandular bodies that excreted a substance that went by ducts into the digestive system, there was scattered in the substance of the gland little isolated groups of cells that did not seem to be attached to the ducts and were not the same as the cells that were excreting digestive material. And the discoverer of these was a German or Dutch anatomist by the name of Langerhans. And so he described them, and they have been, since that time, called the Islets of Langerhans, since they seem to be floating around at various places in the organ without being connected. The role of these organs and these cells had in the whole schema of things was long unknown until in the early 1920s at the University of Toronto, a couple of young physicians in training decided to do some experimentation with diabetes in dogs, and in which they would excise the pancreas of the dog, and the dog would develop then, amongst other problems, the diabetes. What happens to make the diagnosis of diabetes is the blood of the recipient would not be able to digest sugar, the main source of the carbohydrates that are used to produce the energy in the animal, would not be able to digest that into energy, and in consequence, the levels of sugar would increase, and the ability to have energy from it would decrease to the point of death of the organism. The finding the cause of it had not begun yet. Well, when they did this, they then decided to look at these pancreas and take the islets that they had and extract what juice they could get out of the islets, dissect them out. They are microscopic, but they can be dissected out of the pancreas. They collect all the ones that they can find in a pancreas and express the juice that's in these, and then give that juice back to the dogs who have no pancreas at this time, and see what it does about the sugar, and it went down. This juice of the islets was not previously known, and so these two experimenters called it juice of the isles, or islets, or insul is the Latin word for island. Insulin is the word that was determined to be called this juice that comes out of the islet cells. So consequently, it was 1921 that that was discovered, and the absence of that material in the body would be productive of diabetes.